Good evening, students. Welcome to the biology class today. And today in this class, we are going to discuss about some of the very important questions which are related to the topic diseases. So here we are is about part 3. Now let us know about the first question. Which of the following diseases are infectious in milch animals? Option A. So here we have few of the statements. So ant diseases. The second here is anthrax, blackwater, cowpox. So here we have to select the correct answer from the codes given below. First option 1, 2, 3, 1, 2 and 3, and the B option second, third and fourth. Option C 1 and 4. Option D 1, 2, 3 and 4. Okay, now let us know about the right answer here. The right answer is option B, 2, 3 and 4. So here we have the second, third and fourth. According to the statement, the question that we have, all of these are the 3 diseases that can be seen here in milch animals. But what are these milch animals? The animals those, okay, the animals which are the source of milk. For example, here we have cow, goat, buffalo. So all of these animals will provide us the milk, right? And so we can call all of these animals as milch animals. And some of the commonly known diseases here in these animals are foot and mouth disease. It's all caused because of one of the virus here called Epithelial. Okay, Epithelial is one of the virus which causes foot and mouth diseases here in the cattle. Okay, specifically here in cloven hoofed animals, specifically here in the cattle that we see observe about. Okay, the limb of them. Okay, that is what we call it as cloven hoofed. That can be observed specifically in the cattle here. And the next one, when we are looking at this anthrax, anthrax is all caused because of the bacteria here, and the bacteria which is going to cause this anthrax disease in the cattle is Bacillus anthracis. Okay, this is a bacteria name. Bacillus anthracis is the one which will cause anthrax disease in cattle. Okay, similarly, when we are looking at the third one, that is black leg, or which we also call it as blackwater. Okay, it is one of the infectious bacterial disease. So here the bacteria, the causative agent is Clostridium chowai. Okay, Clostridium chowai is the one of a bacteria here that causes black leg disease in cattle. Okay, specifically here in cattle, sheep as well as goats, all of these milch animals. And similarly the cowpox. Okay, cowpox is caused by cowpox virus, one of a virus here which is very infectious, specifically in these milch animals. Okay, so based on this, we can select that second, third, and fourth. All of these are the diseases specifically caused in milch animals. Move to the next question now. Consider the following statements. Meningococcal meningitis is transmitted from person to person by mosquito bites. Vomiting and neck pain are 2 of the symptoms of meningococcal meningitis. So which of the statements given above are correct? So option A, 1 only. Option B, 2 only. Option C, both 1 and 2. And option D, neither 1 nor 2. Okay, now let us know about the right answer here. The right answer is option B, 2 only. So out of these 2 statements, the second statement that we have here is correct. Okay, let us know about this here. Meningococcal meningitis. Okay, so one of a bacterial disease here. That is the one which is basically transmitted from one person to another through air. So when we are breathing in the same polluted air, if the air that we breathe in it may contain the smallest droplets of this meningococcal meningitis. So in these droplets, if there is a presence of these bacteria, and if we respire in the same, if we inhale the same, then definitely that enters our respiratory system, right? So when it enters our respiratory system, it is going to cause several respiratory disorders. Okay, so here we have respiratory secretions, and it's also because of the direct contact with an infected person. So if we come directly in contact with of infected person through the oral secretions, oral contact, even this meningococcal meningitis can enter a new healthy individual. Okay, so it is one of the causative agent here. And when we are looking at the symptoms of this here, vomiting, neck pain, so all of these are the common symptoms that can be observed here in this case. Okay, so based on this, we can say that the second statement that we have here is correct. It's not through the mosquito bites. So since there is a mosquito bite, it is not a vector here which is carrying. Through the agents, that is air, so this meningococcal meningitis can enter our respiratory tract. Okay, moving to the next question now. Consider the following statements and select the correct answer from the codes given below. Assertion: if somebody stops taking green vegetables, he will suffer from night blindness. Reason: he will suffer from vitamin A deficiency. So option A, here we have both A and R, that is assertion and reason are true, but R is the correct explanation of A. Option B, both A and R are true, but R is not the correct explanation of A. Option C, A is true, but R is false. Option D, A is false, but R is true. Okay, now let us know about the right answer here. The right answer is option A. Okay, so that is both A and R are true. And also the reason that we have here is a correct explanation of assertion statement. Let us know about this here now. Vitamin A. So it is one of the nutrients that our body requires, right? It has a major role in phototransduction. That is, it will convert all the light energy that enters our body, okay, that enters through the lens of our eyes, right? The light into electrical potential over the cell membrane. So that is what is the meaning of this phototransduction. Light into electrical energy, electrical impulses here. Okay, so it's deficiency. If we doesn't have this vitamin A in our body, then that causes a deficiency of the same. Now, if there is a deficiency of this vitamin A, that can cause night blindness in human beings. Okay, night blindness is one of a condition where a person cannot identify, differentiate between this green as well as red color. Okay, and here xerophthalmia, keratomalacia, okay, all of these are the other deficiency diseases which are caused because of this vitamin A deficiency. So when we are looking at the source of this vitamin A, how do we get this vitamin A to our body? So when we consume this green or yellow or orangish red, so dark colored fruits and vegetables specifically, and also egg or milk products, fortified cereals. So all of these are the food sources which are rich in vitamin A. So when we are consuming this, all the food sources here, definitely we will get this vitamin A so that we can prevent this deficiency disease called night blindness. Right? So their avoidance, that is, if you are not consuming this vitamin A in our diet for longer period of time, that can lead to vitamin A deficiency symptoms. Okay, so we have that both of these statements are right according to the given statement here. Moving to the next question now. Consider the following statements. Dengue is a protozoan disease transmitted by mosquitoes. Retroorbital pain is not a symptom of dengue. Skin rash and bleeding from nose and gums are some of the symptoms of dengue. So which of the statements given above are correct? So option A, 1 and 2 only. Option B, 2 only, option C, 3 only, and option D, 1 and 3 only. Okay, now let us know about the right answer here. The right answer is option C, 3 only. So when we are considering this here, actually the first statement as well as the third statement, both we can consider. I will make it as D because, so here we know that dengue, right? Dengue is a disease which is all caused because of a protozoa. If that protozoa enters our body, then a person will start suffering from this dengue disease. Okay, protozoan disease which is all transmitted by mosquitoes. Here the mosquito which is carrying this protozoa is female Anopheles mosquito. Sorry, female Aedes mosquito is the one which causes dengue. Female Anopheles mosquito is the one that causes malaria. Okay, here the mosquitoes are the one which acts as a vector here in carrying this protozoans. Okay, so from the infected person, if it gets this protozoans to the normal healthy person, then usually there will be transmission in the disease, right? So when we're looking at the second statement that we have here, retroorbital pain is not a symptom of dengue. Your retroorbital, which is nothing but the pain at the back, eye back wall, right? Eyeball that we have at the back part of this eyeball, there in the retina part, usually there will be a pain. Okay, the pain there will be in the eyes here. So that is one of the symptoms of this dengue disease, right? So by this, we can say that this is not the correct option, correct statement, right statement here, because it is one of the statement, one of the symptom of dengue here. So when we are looking at the last statement, skin rash, bleeding from the nose as well as the gum that we have in the mouth. Okay, so there where our tooths are joined to the roots of the jawline here in the gums, as well as it is also characterized by eye fever, severe muscle pain, joint pain, all over the body. There will be rashes. Okay, all of these are the different symptoms of dengue. Okay, moving to the next question now. Consider the following statements. ELISA test is employed as the first and most basic test for an individual to detect cancer. Almost 50% of human beings have Rh positive blood, while the remaining have Rh negative blood. So which of the statements given above are correct? So option A, 1 only, option B, 2 only, option C, both 1 and 2, and option D, neither 1 nor 2. Okay, now let us know about the right answer here. The right answer is option D, neither 1 nor 2. So both of the statements that we have here, both of these are not correct. Okay, according to the blood that we are looking at. So here, when we are looking at the first statement here, ELISA test. ELISA test is the one which is carried to detect HIV or the AIDS which is present in an individual. Okay, it is the most basic test which is usually carried out to test whether the blood will carry the antigens for this antibodies for the specific virus called HIV. Okay, if the virus or if the antibodies are present in the tested sample here for this HIV, then the secondary test for the confirmatory test is done. Okay, that is Western blotting is the confirmatory test for this AIDS, right? So your ELISA test is carried out as a first and primary test here to detect AIDS disease in an individual. Okay, so it is not for cancer. So when we are looking at the second statement, so almost 85% of the human beings, they have Rh positive protein in their blood. Okay, Rh positive is one of a protein which is basically present in the blood of an individual. Okay, so Rh protein that we usually call it as. So blood groups like A positive, B positive, AB positive. So here positive that indicates Rh positive. That is the rhesus genes. So which is basically extracted from rhesus monkey, one of a monkey called rhesus monkey. So from that usually they extracted this protein. Okay, and the same protein is also present in human blood. Approximately about 85% of the human being will carry this Rh positive blood, right? That is a positive blood group. So the remaining, that is approximately about 50% of the people, they will carry this Rh negative blood. That is, their blood will not contain these proteins. If the proteins are present, then we call it as positive. Then if it is not present, if it is absent in the blood sample, then that is negative. Clear? Only 15% of them will not contain this Rh proteins in their blood. So both of these are the factors which are present in the blood, and it was all discovered by Karl Landsteiner. Okay, Karl Landsteiner, he was the one who detected this Rh protein in blood sample just by experimenting that on a monkey called rhesus monkey. Clear? Move to the next question now. Match list 1 with list 2 and select the correct answer from the codes given below the list. So under this list 1, we have plague. Under list 2, we have protozoa. Under list 1, AIDS. Under list 2, it is fungus. Under list 1, it is baldness. So here we have virus, malaria, and here it is bacteria. Now the codes that we have here is option E, 1, 2, 3, and 4. Option B, 2, 3, 4, 1. Option C, 3, 4, 1, 2. And option D, 4, 3, 2, 1. Okay, now we'll know about the right answer here. The right answer is option D, 4, 3, 2, 1. So here we have the right answer. Now let us try to match here. Plague. Plague is all caused because of a bacteria. Okay, bacteria, one of a species of bacteria is one that causes plague in an individual. AIDS is all caused because of the virus. Here the virus is HIV virus. Okay, human immunodeficiency virus is the one that causes AIDS. It is one of a syndrome in an individual. Okay, baldness. It's all caused because of the fungus that enters the stem cell of the area. Okay, the cells that we have on the air. So here the fungus, if it is present there, that is the one which is the major reason for the baldness in an individual. That is one of the reason. Okay, and it can also be because of hereditary too. And the malaria, it is all caused because of protozoa. Okay, protozoa, here it is all carried by a vector called, the vector here, the one vector which usually carries this protozoa is the mosquito. Okay, female Anopheles mosquito is the one that carries protozoan species here, which causes malaria. Okay, now move to the next question. Consider the following statements and choose the correct ones. Once the HIV gains a foothold, it can never be eradicated from the body. Many HIV patients, however, can manage the infection with a cocktail of drugs. So it is very mutable and infects the respiratory system itself. Option A, 1 and 2 only. Option B, 2 and 3 only. Option C, none. And option D, all are correct. Okay, now let us know about the right answer here. The right answer is option are correct. So all the options that we have here, all of these are correct options. Okay, let us know about this here. It is highly mutable retrovirus. So this HIV virus belongs to retrovirus family. Okay, highly mutable. That is, it can be transmitted from person to person usually when there is a direct contact. And it also remains dormant in the body. So when we are looking at that, it can even suppress our immunity system. Okay, the immune system, specifically the T cells that we have in our body, which are synthesized in our body, that can fight against the foreign bodies, right? If the germs that enters our body, usually basically these T cells are the one that will kill off, right? But here, when we are considering this HIV here, HIV is dormant than that of the T cells that our body synthesizes. Okay, even it can kill and suppress these T cells here. So there is the power of this HIV virus. So once it enters our body, it is more difficult for us to detect and also to remove it from our body. Okay, for many years, it remains in our body. So as and when this HIV virus enters our body, it usually takes around approximately about 10 years to develop AIDS disease. So if the AIDS disease is developing today, it would have entered 10 years before. Okay, the virus would have entered 10 years before, earlier than the period now. Okay, in that infected individual. So HIV virus entering our body today. So the next 10 years, only after the next 10 years, it will show the symptoms of AIDS. Okay, so longer days it requires to show the symptoms, and it is highly mutant virus. Clear? So the patient can also live. The patient, infected person can also live a normal life by taking antiretroviral therapies. Okay, so which we generally call it as ARTS, antiretroviral therapy, which can fight against this retrovirus. It can suppress the load of this. Okay, when an individual is taking this retroviral therapies, usually that minimizes the viral load in that body. Okay, in a person's body, usually internal system of our body. So the viral load can be minimized by taking this drugs, the medicines here. Okay, move to the next question now. Match list 1 and list 2 here. Under list 1, we have organs of the body. Under list 2, process of treatment. So here we have heart. And under list 2, cataract operation, kidney, angioplasty, eye, hysterectomy, and uterus dialysis. So here we have the codes. Option A, 1, 2, 3, 4. Option B, 2, 4, 1, 3. And option C, 4, 2, 1, 3. Option D, 1, 2, 4, 3. Okay, now let us know about the right answer here. The right answer is option B, 2, 4, 1, 3. Okay, so here we have the right option, heart. If there is any blockages here in the heart or the blood vessels that we have, usually to remove these blockages, to have a normal flow of the blood, angioplasty is done. Okay, heart. Angioplasty is one of a procedure of the treatment that is done to remove the blockages in heart as well as the blood vessels. Here, when we are looking at the kidneys, usually if the kidney fails, dialysis is one of the treatment that is carried out, because it has to remove the toxic substances as well as the excess amount of water that we have in our blood. To remove all of this, dialysis is the one that is carried out. It behaves as artificial kidney. Okay, external filtering machine of our body. So here, eye. So if there is any infection here in the eye, so cataract operation is the one that is related to that of our eyes, because in the lens that we have, usually a cloudy, white, cloudy formation that can be absorbed here, and that is what we call it as cataract. Okay, that develops there in the surface of our lens of the eyes. Okay, usually in the cataract operation, this cloudy lens are then removed, and then they will usually insert the artificial lens. Okay, so they will intact the same with artificial lens to restore the normal clear vision. They will remove this cataract lens, the lens which is already affected because of this cataract growth, and they will remove that, and in the same place they will insert it with intact artificial lens. Okay, to have a normal sight. Uterus, So the complete removal of this uterus due to various reasons. So that procedure we call it as hysterectomy. If there is any infections here in the uterus, uterus has to be removed completely. And that procedure we call it as hysterectomy. Okay, moving to the next question. Match list 1 with list 2. Under this list 1, we have carcinogens, different carcinogens, that is the cancerous cells, and the organs affected because of this carcinogens. Cigarette smoke. Under list 2, we have lungs and arteries, mustard gas, lungs, asbestos, lungs and pleural membrane, vinyl chloride, liver. Okay, now we'll look at the right answer here. So options that we have here is 4, 3, 2, 1. Option B, 1, 2, 3, 4. Option C, 4, 2, 3, 1. And option D, 3, 2, 4, 1. Okay, now let us look at the right answer. The right answer is option B, 1, 2, 3, 4. So all the options that we have, both of these are correctly matched. Okay, so this is how we can match them. So here, when we are looking at the cigarette smoke, the smoke of the cigarette usually it consists of N-nitrosodimethylamine. Okay, one of an amine group, N-nitrosodimethylamine. This is one of the reagent that is actually present here in the smoke. And now, usually if a person directly or indirectly, if they are exposed directly into the smoke, and if they are inhaling the same smoke, specifically this chemical that enters the respiratory tract. And if it enters the respiratory tract, that can get accumulated, okay, because it is completely toxic to the lungs as well as the arteries that we have. Usually we know that near the alveoli part of our lungs, blood vessels, that is the capillaries, are attached. So now, if this N-nitrosodimethylamine, if it enters our lungs, it will get accumulated there in the lungs as well as the arteries of the blood that we have. Okay, arteries is one of a blood vessel here. So both of these are accumulated with that of this chemical, right? So when it accumulates, it completely blockage the movement of the air, right? So that there will be no proper exchange of the gases that can be done in this case. So when we're looking at the second one that we have here is the mustard gas. It is highly carcinogenic, which is nothing but a cancerous one. Okay, chemically known as bis-2-chloroethyl sulfide. Okay, mustard gas, chemically we call it as bis-2-chloroethyl sulfide. Okay, it has a sulfide group here, and if it enters our body, it blocks the lungs as well as it affects the respiration process. Okay, a person who is regularly, continuously breathing this mustard gas cannot breathe regularly. Okay, they will usually face with a breathing problem later there in the stages of their life. Okay, so and also along with that, it is a strong mutagen. It will get usually affected. So it can survive in the body as well as it also starts affecting the rest of the parts of our body. And carcinogenic, that is cancerous one. It spreads to other parts of our body as well. Okay, so when we're looking at the third option that we have here, asbestos. So usually all of these are present in the air itself, since they are very small, tiny fibers. While breathing the air that enters our respiratory tract also, through the nostrils that enters our body. So now as and when this asbestos in huge quantity, if it enters our body, it affects our lungs as well as pleural membrane. Pleural membrane or nothing but the inward membrane of our lungs. Okay, the inward membranes that we have in the lung region, that we call it as pleural membrane. Okay, our lungs has this pleural membrane. So here, as and when it enters our body, definitely it affects our lungs as well as the pleural membrane. Okay, this is asbestos. So the last that we have here is vinyl chloride. it directly affects our respiratory tract as well as the liver. Okay, the side effects here that can be absorbed here in the liver. It is highly toxic, poisonous one, flammable, and also carcinogenic. Okay, and also cause angiosarcoma in liver. It is one of a cancerous one. Okay, carcinogenic, which is nothing but a cancerous cell. So if it enters, if it affects our liver, the normal functioning of the liver will be affected. Okay, if our liver does not function properly, regularly, normally, then it can be fatal again. The person may die. Okay, move to the next question now. Match list 1 with list 2. Under this list 1, we have phobia. Under list 2, maladaptive habit, neurosis. Here we have undue concern about health. Hypochondria. Here we have lack of sleep. Insomnia. Here we have intense fear. So options are option A 1342, option B 2431, option C 4123, and option D 3214. Okay, now let us look at the right answer here. The right answer is option C 4123. Okay, let us try to match this here. Phobia. Generally, we call this phobia. It is nothing but intense fear. Fear for anything that is present in our daily life, that we see around daily life, right? So here, if fear to anything that we look around, that we call it as phobia. Okay, it is a kind of intense fear from something. For example, here we have hydrophobia, which is nothing but the phobia that is fear of water. Okay, fear towards the water here. Allurophobia, it is a fear of cats. Astrophobia is a fear of thunder and lightning. Okay, if you the person, they usually have this fear of towards the thunder as well as lightning. And this fear, we call it as astrophobia. Similarly, Achleophobia, it is a fear of darkness. Okay, so they usually doesn't enter in a dark region. Okay, so because of the fear that they have, and the condition that we call it as achleophobia. Okay, it is a fear, intense fear towards something. Neurosis. Okay, neurosis here, it is all due to maladaptive habit. Okay, which is completely towards a mental illness. If a person develops a mental illness because of this neurosis, where the neuron cells that they have in the brain would have been damaged here. Clear? So due to this damage, they will start developing a maladaptive habit. It's all because of the mental illness. And it is not completely regarded to that of the mentally retarded people that we see around us. Okay, few of the people that we see around us, mentally retarded, it is not completely related to that. So your neurosis can be curable. It can be minimized in an individual. Okay, usually the person with this neurosis, they will usually have the symptoms such as worrying. Okay, worrying for even the simple things. There will be a fear, anxiety, feeling of insecurity. So all of these conditions can be absorbed in a person who is suffering from this neurosis. And because of all of these reasons, okay, all of these causes, so this maladaptive habit can be developed in them. Okay, they will develop this maladaptive habit. Okay, so hypochondria. Hypochondria is nothing but undue concern about their own health. Some of the people around us, you would have observed that. So usually they will start concerning. They will have the concern about their own health itself. Unnecessary concern. Even though they are normal, healthy being, usually some of them will have unnecessary excess concern about their own health itself. And that condition, we call it as hypochondria. Okay, insomnia, which is nothing but lack of sleep for longer period of time. If a person is not able to sleep regularly during the night time usually, so that condition can be called as insomnia. And this is the one common, it is common during pregnancy stage in female, right? Moving to the next question. Match list 1 with list 2. List 1, under this we have disease, under list 2 we have meanings of this disease. jaundice, and here under list 2 we have allergic inflammation of nose, stenosis, loss of motor functions, rhinitis, so defect of heart walls, paralysis, increase in bile pigments in the blood. So option A 1423, option B 3214, option C 4312, and option D 2134. Okay, now let us look at the right answer here. The right answer is option C 4312. Okay, your jaundice is all caused because of the increase in bile pigment in the blood. If our bile pigment is all secreted by the liver, right? Liver, then it is temporarily stored in the gallbladder, then secreted during the digestion of the food. So now, if this bile pigment increases in our blood, okay, that condition called as jaundice. Okay, usually in this condition, it will turn yellowish of the skin. Okay, our skin will turn yellowish in color, as well as the cornea of our eyes, right? All of this will turn yellowish in color because of the presence of the bile pigments. Stenosis, here stenosis is nothing but the defect in the heart walls. If there is any defect in the blood vessels or in the heart wall, and usually the blood vessels will start narrowing. Okay, it will start narrowing so that the blood supply to the different parts of our body will be affected in this condition. It cannot pump the blood, and that condition can be called as stenosis. Okay, rhinitis, it's nothing but the allergic inflammation of the nose. If there is any allergic infection because of some of the bacteria or the virus that enters, or even the fungal, the black fungus that we recently heard about, right? The yellow fungus. So all of these fungus or any bacteria that can cause these allergies in our nose, or it can be for different chemical reasons, right? So this allergy, because of this, there will be inflammation in the nose, and that condition we call it as rhinitis. It's one of a disease here. Okay. Paralysis is nothing but the loss of motor function. All the voluntary muscles that we have, it cannot work properly here in the condition of paralysis. Okay, motor function, that is nothing but the voluntary action that we carry out, walking, sleeping, sitting, all the muscle control that we have under our control, we can control them. Such functions are lost in the case of paralysis. Okay, it is completely due to damage in the nervous system. Into the next question now. The main reason why antibiotics could not solve all the problems of bacterial diseases is insensitivity of the individual following prolonged exposure to antibiotics, inactivation of antibiotics by bacterial enzymes, decreased efficiency of immune system, the development of mutant strains, resistant to antibiotics. Okay, now we'll know about the right answer here. The right answer is option D. Okay, option D that we have here. The development of mutant strains, which is resistant to specific antibiotics. Antibiotics are the external medicines that we take in when we suffer from specific infection. It can be bacterial infection, right? So when we are suffering from this, usually from the fungal infections also, there the doctors will usually prescribe us with antibiotics, specific antibiotics which can fight against the germs that would have entered our body, causing diseases. Okay, now when we take in this antibiotics, even though if you are taking in the prescribed quantity, it cannot work in our body. The major reason for this here is mutant strains. Okay, so the bacteria or the virus that entered our body, usually it would have started developing into different strains of that. Okay, if there is a mutant strains of these bacteria or the fungal matter in our body, then definitely they are not directly affected because of the antibiotics that we're taking. Okay, they are completely resistant to the antibiotics. Clear? So some of the microbial species, as we know that there are many different microbes that can enter our body, right? For example, when we are looking at this coronavirus, so coronavirus, it is the one which is developing different strains nowadays, right? So most of these are mutated one, and even though we are targeting on the vaccine here, one of it can be destroyed. Okay, the particular one can be destroyed. But since it is mutating here regularly, the mutant strains cannot be affected because of the antibodies or the vaccines that we are taking here, respectively. Okay, so when we are considering the bacterial infection here, definitely these strains, since they are mutated one, they will be completely resistant towards the antibiotics. So these antibiotics does not work in our body at all. Okay, they are completely resistant to that, so that it will not even die there. Understood? So now, moving to the next question. Diabetes mellitus takes place only when alpha cells of pancreas are in excess, beta cells of pancreas are in excess, alpha cells of pancreas are in hypo, that is reduced quantity. Beta cells of pancreas are in hypo. Okay, now we'll look at the right answer here. The right answer is option D. Beta cells of our pancreas if it is in hypo condition. Okay, if our pancreas, so in the pancreas is one of the gland that we have in our body, right? So in this pancreas, there will be islets of Langerhans. Here in the islets of Langerhans, there will be presence of all of these cells, that is alpha cell, beta cells, and also delta cell. Okay, all of these different cells are present here in the islets of Langerhans of the pancreas. Now, all of these are the cells which will secrete the different hormones that is required for the metabolism of our body, metabolism of different things in our body. Now, when we are looking at this alpha cells, so they usually secretes peptide hormone called glucagon. It is one of a peptide hormone, glucagon, okay, which has a major role in metabolizing glucose in our body. Okay, so glucagon is one of the hormone required here. And beta cells, okay, beta cells that synthesize and secretes endocrine hormone called insulin. Insulin is also one of the cell here that is necessary because that is the one which usually metabolizes the blood sugar level. The quantity of the glucose which is present in the blood, it is all regulated by the insulin content in our blood. Okay, if our pancreas, if it fails to secrete the normal quantity of the insulin, then definitely this glucose quantity increases in the blood because it cannot be metabolized by this insulin now, since there is a lack of insulin. So now, as and when there is a decreased quantity of this beta cells in our body, insulin will also be in less quantity, right? So as and when the insulin quantity decreases, glucose quantity increases in our blood. If glucose quantity increases in our blood, that leads to diabetes mellitus, that is the disease, right? Blood sugar that we generally call it as, right? So when we are looking at the last cell, that is delta cell, that is the one which usually secretes somatostatin. Okay, somatostatin. So here basically this somatostatin, it is required to prevent the production of other hormones. And also it usually stops the unnatural rapid production of the cells. Unnecessary cells will not divide here for the formation of new cells. It's all regulated by this somatostatin. Clear? Basically, we require this insulin in a right quantity to prevent this disease called diabetes mellitus. Moving to the next question. Consider the following statements and select the correct answer from the codes given below. Assertion, here we have, in filariasis, the lower legs and scrotum or swell to unproportionate level. Reason, the filarial worms block the lymph vessels and lymph node. So both A and R are true, and R is the correct explanation of A. Both A and R are true, and R is not the correct explanation of A. So A is true, but R is false. A is false, but R is true. Okay, now let us look at the right answer here. The right answer is option A. Both assertion as well as the reason, both of these statements are correct here. And the reason here that we have, it's also the correct explanation of the first statement. Okay, basically this lymphatic filariasis, the lymph node lymphatic system that we have, it is one of the transporting system that we have in our body, just like the circulatory system, lymphatic system, right? Here this lymphatic filariasis, it is one of a worm here that enters our body and causes a disease called filariasis, specifically here in the lymph nodes, lymphatic system. So here we have a name called lymphatic filariasis. It's all caused by a nematodes. Okay, nematodes or the worms here belongs to a genera Wuchereria bancrofti. Okay, it belongs to a genera called Wuchereria bancrofti. So this is the specific worm that causes lymphatic filariasis. It is one of a disease. So along with this Wuchereria bancrofti, the rest of the worms that we have here is Brugia malai, Brugia timori. So all of these are the nematodes, the worms. Generally, we call them as the worms. Okay, so here the spores or usually the larval stage or the egg stage of these worms that enters our body through the contaminated water or the contaminated food, that will start affecting, it will start growing in our body. Okay, because we will become the host for them. It will use all our nutrition and it will start growing. So in this condition, it is a parasitic worm, so that it will utilize our body nutrition. In return, it will cause us with the diseases. It will damage our internal system. Okay, so it is going to directly target our lymphatic system as well as lymphatic nodes. So both of this will be blocked. Okay, in a chronic cases, but in chronic cases, that is if this disease is not treated on time. Okay, this disease can remain within us for longer period of time. So we can consider it as chronic disease, right? So these worms that lead to a disease called elephantiasis. If filariasis is not treated on time, it can become chronic in stage. That can lead to a disease called elephantiasis. So in the case of this elephantiasis, usually the leg as well as the genital organ usually will start swelling up. Okay, there will be swollen part in the leg, and usually in this disease, the legs of an individual will usually appear the legs as that of the elephant. So we have a name called elephantiasis for the same disease here. Okay, which is all caused by a worm called Wuchereria bancrofti. Move to the next question now. Consider the following statements. Progeria is the genetic disease which is associated with fast aging. Progeria patients never live beyond early years of 5 or 6. Which of the statements given above are correct? Option A, 1 only. Option B, 2 only. Option C, both 1 and 2. And option D, neither 1 nor 2. Okay, now let us look at the right answer here. The right answer is option A. Okay, only the first statement is correct. But the second statement that we have here is not correct. Okay, let us know about this here. Progeria, which we also call it as Hutchinson-Gilford Progeria Syndrome. It is one of a syndrome here. Hutchinson-Gilford Progeria Syndrome. It is one of a genetic disorder that we acquire from birth. Okay, inherited diseases. So we will get it from our parents, from one generation to the next. Okay, so with a defect in one of a gene called LMNA, specific chromosome in our body during the fertilization process, usually the gene here, LMNA gene, if it gets defect here, if there is any defect found in this gene, that causes a disease called progeria. It is one of a syndrome. What actually happens here in this syndrome? So that is the one in which the aging process is manifested. Usually we say that human beings can survive approximately about 60 to 70 years. So that is 70 to 80 years approximately of this age, right? But here in this case, that is a patient's, okay, person, if they are suffering from this syndrome called progeria, the aging process itself is manifested. Okay, it is altered here. They will die at very young age. So approximately about this progeric children, they can typically live for till their mid-teens or early 20s. So due to this aging process, they will die naturally at this age. Okay, it's one of a syndrome here that causes aging. Okay, that manifests this aging process in this children. Clear? Moving to the next question. Match the list 1 with list 2. Under this list 1, we have a disease. Under list 2, we have causating agent of this disease, particular disease here. Amoebiasis, Trypanosoma gambiensis, okay, sleeping sickness, Trypanosoma pallidum, Syphilis, Entamoeba histolytica, bubonic plague, Pasteurella pestis. So option A, 1342, option B, 3124, option C, 4231, and option D, 2412. So 2413. Okay, now we'll look at the right answer here. The right answer is option B, 3124. So when we are matching this here, amoeba is all caused by, okay, so here Entamoeba histolytica is the one that causes amoebiasis. Okay, amoebiasis is one of a disease in which the symptoms are chronic diarrhea. So diarrhea to fulminant dysentery. If it is not treated on time here, it can become chronic in a type. Okay, chronic. So that can lead to dysentery here. So it's all caused by one of a amoebic species here, Entamoeba histolytica. Clear? That causes amoebiasis in an individual. So now the next one that we have here is sleeping sickness. It's all caused by Trypanosoma gambiensis. Okay, Trypanosoma gambiensis is the one. So it is the one that causes sleeping sickness in an individual. Okay, Trypanosoma gambiensis. So usually when there is a sleeping sickness in an individual, the symptoms associated with this disease are fever, joint pains, numbness, poor coordination, as well as trouble in sleeping. They cannot even sleep regularly, okay, in a normal interval of time here. So it's all caused because of one of a viral here, Trypanosoma gambiensis. Okay, syphilis is all caused because of Trypanosoma pallidum. Okay, Trypanosoma pallidum, it is one of a STD, that is sexually transmitted diseases. Okay, syphilis is one of a STD, sexually transmitted diseases, which is all caused because of Trypanosoma pallidum. If this enters our body, it can cause a disease called syphilis. Okay, so it is one of a spirochete bacterium, the spiral shaped here that can be absorbed here in this bacterium. Okay, the last here we have here is Pasteurella pestis. Okay, pastoral Asbestos is the one that causes bubonic plague in an individual. Usually in this condition, during a plague, the lymph node or the lymphatic system will start swelling up. Okay, swollen lymph node, so that all these lymph nodes are in excess. Specifically, it is targeted, concentrated there in the armpit region as well as the groin region, right? So now if the individual starts suffering from this bubonic plague, so here the lymph nodes which are present in armpit as well as the groin region are the one majorly affected. It will start swelling up. Okay, move to the next question. Which of the following statements are correct? Stewart disease of corn is caused by Erwinia stewarti. The primary vector of Erwinia stewarti is corn flea beetle. So here the beetle, that is Ceoctonema pulicariae. Okay, Ceoctonema pulicariae. So options are option A, 1 only, option B, 2 only, option C, both 1 and 2, and option D, neither 1 nor 2. Okay, now let us look at the right answer here. The right answer is option C. Okay, option C, that we have here both the first and second statement both are true here. Let us look at this. Stewart disease. Stewart disease is usually the leaf of this maize plants, because maize plants or the corn plant, they are majorly affected here because of this Stewart disease. It's all caused because of the bacteria here called Erwinia stewarti. Okay, Erwinia stewarti is the one of a bacteria here which causes a disease called Stewart's wilt. So now the wheat leaves here, maize leaves, it will start wilting. The margin of the leaf will start rolling down. Okay, that is one of the symptoms that can be absorbed here in Stewart disease. So here it's all caused by a vector called, okay, so one of the vector here is a flea beetle. Corn flea beetle is one of the vector here which will carry this Erwinia stewarti to cause a disease called Stewart disease. Okay, corn flea beetle. So Ceoctonema pulicaria. So this is one of the vector that carries this Erwinia stewarti to cause a disease, Stewart disease, specifically in maize plants. Okay. The next question. Consider the following statements. Hashimoto disease results in thymosin deficiency. Cretinism in children occur due to thyroxine deficiency. So which of the statements given above are correct? Option A, 1 only. Option 2, 2 only. Option C, both 1 and 2. And option D, neither 1 nor 2. Okay, now let us look at the right answer here. The right answer is option B, 2 only. So when we are looking at these two statements, the second statement is correct here, because Hashimoto disease results in thymosin deficiency. So here, when we are looking at this here, thymosin is one of the hormone which is secreted by thymus gland, but we are concentrating on thyroid gland which is specifically present in the thyroid region of an individual, right? So here Hashimoto thyroiditis is an autoimmune disease where the thyroid gland is all attacked by various types of cells. So when there is attacking of this various types of cells in the thyroid gland, specific antibody mediated immune process. So it cannot function normally. It cannot synthesize the hormone. Clear? So it results finally in hypothyroidism. Thyroid cannot synthesize the hormone called thyroid hormone, right? So that condition leads to thyroidism, hypothyroidism. So lack of secretion of thyroid hormone in this condition. But when we are looking at the second statement, cretinism in children occurs due to thyroxine deficiency. So in a condition called cretinism, the symptoms that can be observed are the children will usually not grow according to their height, according to their age. Okay, when we are looking at the BMR rate here, they will not grow according to the age that they are growing in. Okay, several stunted physical as well as the mental growth. They will not grow approximate height here, and it's all because of untreated congenital deficiency of this thyroid hormone. If the thyroid hormone is not secreted in such case, so the growth hormone, one of the growth hormone here, a person, an individual cannot grow according to the normal BMR rate. Okay, that can lead to maternal hypothyroidism. Okay, lack of this thyroid hormone secretion in an individual. Looking at the next question, consider the following statements. ECG is a test that measures the electrical activity of the heart. ECG is not used to measure the rate and regularity of heartbeats. So which of the statements is given above are correct? So option A, 1 only, option B, 2 only, and option C, both 1 and 2, option D, none of these. Okay, now let us look at the right answer here. The right answer is option A, 1 only, because here we have the first statement which is correct and the second statement which is not correct. Because ECG, which is nothing but electrocardiography, a test which is related to the heart rate, okay, to measure our heartbeats here, ECG test is the one that is carried out, because that is the one which measures our electrical activity of our heart, the pumping system of our heart. Okay, the pumping rhythmic contraction as well as this relaxation of the heart is measured with the help of this ECG, electrocardiology. Okay, now ECG will also measure the rate and regularity of our heartbeats. Okay, it measures the rate and also the regularity. A normal healthy person, their heart has to beat approximately about 72 beats per minute. That can be observed, right? 72 BPM, beats per minute, that can be observed in normal adult healthy human being. So here to measure this, ECG test is the one that can be carried out. So here when we are looking at this statement, ECG is not used. So since they have mentioned not used, we can directly rule out this option. Moving to the next question, match list 1 with list 2. Under this list 1, we have neoplasm. Under list 2, we have hematopoietic cell tumors. Here under list 1, benign. List 2, bone or cartilage tissue tumor cancers, carcinomas, malignant tumor, and here we have sarcomas, cancer of epithelial tissues. So the last option that we have, lymphomas, non-cancerous tumors. So here under list 2, we have the next option, initiation of new tumors. So options are option A, 35421, option B, 25436, option C, 64321, option D, 23564. Okay, now let us look at the right answer here. The right option is option A, 35421. Okay, so here we are going to match it. Before that, your benign tumors, the cancerous cells that can be classified into 2 groups. Okay, basically the cancer, we will group it as 2 groups, benign tumor as well as malignant tumors. Okay, benign tumors and malignant tumors. These tumors, specifically when we are considering this benign tumors, they are the one usually that does not spread from its formation site. Okay, wherever the body part that we have. So all over the body part, if it has developed at specific site here, usually this will not spread to the other surrounding cells here. Okay, so that is the one which we call it as benign tumor, and it is non-cancerous in nature. Okay, it can be operated and easily it can be treated to remove that tumors here. So wherever that we have in our body, so these tumors can be easily removed and it is not harmful to our body basically. Okay, it does not cause any cancer. It is not a dangerous one. But on the other hand, we have this malignant tumors, which are usually basically dangerously cancerous cells, because they are the one, as in when they grow, the cell will start dividing and it will start spreading to the normal healthy neighboring cells also. If it has developed at a specific site in our body, specifically on the skin surface, it can even damage the inner part of our body, all the organs that we have in our body. If it is not treated on time, it can go up to stage 4. Okay, so here when we are looking at this malignant tumor, they are completely dangerous one, and it is the one that can lead that can be fatal. Person, if they are not treated with this, definitely they will die, right? Because of multiple organ failure. When we are looking at the options here, neoplasm. Neoplasm is the one, a malignant tumor, cancerous cell, completely dangerous one. Benign. Okay, on the other hand, here we have, that is a benign. Okay, benign, we know that it is the non-cancerous tumor, right? Carcinomas. So carcinomas are the one. So basically they are cancer here in epithelial cells. Okay, the epithelial cells that we have. So here we have cancer of epithelial tissues. Epithelial cells are the one which we have beneath the skin surface. The skin surface is all made out of epithelial cells. All the organs that we have internally, for example, stomach or the liver or the kidneys or even the small intestine, large intestine, all of these are externally made out of this epithelial tissues. There is a covering of these tissues. Okay, and if the cancerous cell found in this part, that can be called as carcinomas. Okay, sarcomas are the one where there will be bone and cartilage tissues. Okay, the cartilage tissue or the bone cells that we have in our body, they are the one which are affected. If it is affected, that can be called as sarcomas. Okay, all these are different types of cancer that we have. So lymphomas are the one which will usually affect hematopoietic cell tumors. Okay, hematopoietic cells, that is the blood forming cells, or the one basically they are affected. So the blood cancer, that can be called as this. Okay, leukemia, lymphomas. Clear? Move to the next question now. Consider the following statements. Statement 1, a color-blind person cannot distinguish red and green color. Color blindness is related to defect in nerve cells. Which of the statement given above are correct? Option A, 1 only. Option B, 2 only. Option C, both 1 and 2. And option D, neither 1 nor 2. Okay, now let us look at the right answer here. The right answer is option A, 1 only. So here the first statement is correct, but not the second one. Second statement is completely false here. It is not true. Okay, colorblind person, they cannot distinguish between red color and green color, because here the cone cells are the one which are sensitive towards the bright light, bright colors like green, red, blue. Okay, so here these cone cells are the one which are not well developed here in the case of a person who was suffering from this color blindness. Okay, that is the reason, that is a major reason they cannot distinguish the colors between red and green. Okay, and here this color blindness is all X-linked disease. Okay, that we will carry it from one generation to the next. We will pass it to the next generation. X-linked disease, X-linked chromosomal disease, clear, genetic disease, hereditary disease here. And it is a condition which we also call it as protanomaly. Okay, protanomaly, where a person is not able to distinguish between green and red color. Okay. So now it is all not, so here this color blindness is not at all related to the nerve cells. Okay, it's all related to the cone cells that we have here there on the retina part of our eyes, which is completely X-linked disease, X chromosome linked disease. Next question, consider the following statements. Swine flu is also called swine influenza. It is an infection caused by swine influenza viruses. So option statement 3, swine flu is transmitted from person to person by inhalation or ingestion of droplets containing virus from people sneezing or coughing. Fourth statement, it is also spread by eating cooked pork. Which of the statements given above are correct? So option A, 1 and 2 only. Option B, 1, 2 and 3 only. Option C, 2, 3 and 4 only. Option D, 1, 2, 3 and 4. Okay, now let us look at the right answer. Here we have the right answer, that is option D. So here we have first statement, second statement and third statement. All these three statements are correct, but not this fourth. So regarding the swine flu. Swine flu is all caused because of swine influenza virus. It's one of the virus that causes swine influenza in an individual. Swine flu generally we call it as. Okay, it is all caused by a virus here. And how does it enter our body? Because these viruses may present in the air that we breathe in. While coughing or sneezing from an infected person's droplet, it enters air. And if we are breathing the same air, if we are inhaling the same polluted air where there will be load of these viruses, that enters our respiratory tract, right? Or if we stand nearby a person who is sneezing or coughing, usually if they are already infected with the same flu, then that can easily enter our body while inhalation process, right? So this is how these viruses enter our body and causes a infection there in the respiratory system. Okay, so here we have the fourth statement. It is not at all spread by eating cooked pork. Okay, if you are eating cooked pork, it does not spread through this pork. Okay, if it is cooked one usually. So fourth statement directly we can rule it out, but first three statements, they are correct according to this swine flu. Moving to the next question. AIDS is transmitted by sexual intercourse, blood transfusion, mosquitoes and other blood-sucking insects. So fourth statement, across the placenta. Select the correct answer from the codes given below. Option A, 1, 2 and 3. Option B, 1 and 2. Option C, 1, 2 and 4. Option D, 1, 3 and 4. Okay, now we'll look at the right answer. The right answer is option C, 1, 2 and 4. So here we have the correct statements first, second as well as the fourth. But third is not at all correct regarding this AIDS. Okay, AIDS is one of a viral disease, acquired immunodeficiency syndrome, right? Acquired immunodeficiency syndrome, which is all related to our immunity system. So it's all caused because of the virus called HIV. HIV is the virus that causes AIDS disease, human immunodeficiency virus. Okay, it can be caused, it can be transmitted from the infected person to normal healthy person through unprotected sexual intercourse. Okay, and sexual intercourse and also blood transfusion from a normal healthy person, right? From an infected person to normal healthy person by using his infected syringe okay, by using the same syringe, or if there is a blood transfusion or body fluids, if it get exchanged here and across the placenta from a mother towards a fetus, right? Mother to fetus, mother to her baby, here this AIDS can get transmitted. Specifically, this virus will get transmitted. Okay, virus, if it get transmitted, then that causes a disease called AIDS, right? But here, when we are looking at the third statement, so mosquitoes are not the one which usually cause this disease, because here it does not require any vector. Okay, AIDS, HIV virus does not require any vector. So even if the mosquitoes bite the same infected blood, and if it sucks our blood, normal healthy person, it will not usually capable of transmitting this HIV virus. So these mosquitoes are not the causative agent of this HIV virus. Okay, moving to the next question. Match list 1 with list 2 and select the correct answer from the codes given below the list. Under list 1, we have diseases, and here under list 2, we have different organs. Okay, the affected organs. So under list 1, we have myxedema. Under list 2, we have reproductive system. Nephrosis, nervous disorder. Paralysis, endocrine gland. And here syphilis, excretory system. So option A, 3412, and option B, 3421, option C, 1243, option D, 2134. Okay, now we'll look at the right answer here. The right answer is option B, 3421. Okay, here when we're looking at this myxedema, it is all these are the diseases that we have. Okay, and these diseases specifically affect the different organ systems of our body. Now let us know about this here. Myxedema. Okay, myxedema is one of a case where there will be usually hyperthyroidism or hypothyroidism. That is, our body can, the thyroid gland that we have in our body, in a case of myxedema, will usually start secreting very less quantity of thyroid hormone, or it can also secrete more quantity of thyroid hormone than the required amount. Okay, and this condition we call it as hypothyroidism or hyperthyroidism respectively. Okay, it's all related to endocrine gland, because the thyroid gland, it is all in the control of this endocrine gland. It belongs to endocrine gland. So myxedema, it is all regarded with that of endocrine gland. Nephrosis. Okay, nephrosis is related to excretory system, because in our excretory system we have kidneys as a major organ. Here in the kidneys, there we have a small structural and functional unit of our kidney called nephron, right? If the nephron is affected in this condition, the disease we call it as nephrosis. Nephron cannot function properly, so that the filtering of the blood does not happen properly in the case of nephrosis. Okay, it is all related to excretory system. Paralysis is all related to nervous system. Okay, the nervous disorder where the nerve cells that we have, neurons which are in the brain or the spinal cord, they are finally affected, which leads to a condition called paralysis. Motor function cannot be carried out in this condition. Okay, specifically there in the cerebrum part of our brain, if it is affected, definitely the motor control, right, motor organs which are in the control of the cerebrum part of our brain, if it is affected, that condition leads to paralysis, right? Syphilis is one of the STD related to reproductive system, sexually transmitted diseases, right, which is all related to reproductive system. Moving to the next question now. Consider the following statements. Hepatitis B is several times more dangerous than HIV or AIDS. Hepatitis B can cause liver cancer. Which of the statements given above are correct? 1 only, option B 2 only, option C both 1 and 2, and option D neither 1 nor 2. Okay, now we'll look at the right answer here. The right answer is option C, both 1 and 2. So here we have both the statements are correct according to this hepatitis B virus. Okay, so when we are looking at this, when we are comparing hepatitis B with that of the AIDS disease here, so can be completely fatal. Person they are who are suffering from this hepatitis B disease, they are highly at life-threatening infection because it can be completely fatal. Person can die. Okay, hepatitis B is potentially life-threatening liver infection. So when a person starts suffering from this hepatitis B, liver is the one of the major organ which would have got damaged here. Okay, so here it's all caused because of one of the virus called hepatitis B virus. So this virus can cause a disease called hepatitis B because as and when this hepatitis B virus enters our body, it is organ manifestation. It shows organ. It targets on specific organ in our body. Here the targeted organ is liver because it directly targets and enters there. It will start multiplying there in the liver itself. As and when it multiplies more in number, it damages the normal cells of the liver. So there will be manipulation in the normal functioning of the liver. Okay, that can cause liver cancer. Okay, so when there is a liver cancer, definitely the complete liver would have got, will be done damage. That can cause the neighboring cells or the tissues that we have in our body will also get damaged because of this, since this is one of a malignant tumor. Okay, so the person will be at very high risk of the death. Clear? And how this virus spreads usually from one person to another. Hepatitis B virus is transmitted between people by contact with that of the blood. If the blood of infected person is administered to normal healthy person, definitely this virus can easily enter the body. Along with that, if there is any exchange in the body fluid like saliva or so that respiratory, okay, the respiratory mucus that we have, or the reproductive glands that we have, or the mucus secretions of this reproductive system, if there is an exchange in this body fluids, easily this virus can enter a normal person, normal healthy person. It will start infecting them too, right? So moving to the next question. According to this, both the statements that we have, here it is correct, because HIV, even though if it enters it directly, immediately it will not cause any serious damages, because once this virus enters our body, it takes around 10 more years to develop AIDS disease. So now it directly targets on our immune system. So slowly our immune system becomes weakened and weakened. So multiple organ failure, person will die. But in the case of hepatitis B, it directly causes cirrhosis of liver. Cirrhosis, which is nothing but inflammation of liver cells, as in when the inflammation, that is swelling part of the liver cells, that can lead to abnormal functioning of the liver. Next question. Match list 1 with list 2 and select the correct answer from the codes given below the list. Under this list 1, we have a disease. Under list 2, we have a cause. So the first year that we have here is Kyra. Okay, Kyra. Under this list 2, cause, vitamin C deficiency. Under list 1, anemia, iodine deficiency, goiter, iron deficiency, scurvy, zinc deficiency. So options are option A, 1, 2, 3, 4. Option B, 2, 1, 4, 3. Option C, 3, 4, 1, 2. And option D, 4, 3, 2, 1. Okay, now we'll look at the right answer here. The right answer is option D, 4, 3, 1, 2. Okay, 4, 3, 2, 1. So Kyra, it's all caused because of zinc deficiency, specifically in case of the plants. Okay, rice plants usually at the base of the leaves, usually in between the rib, mid-rib here, yellow patches can be absorbed. Okay, in between the mid-rib, yellow patches can be found, And that's all because of zinc deficiency. Zinc is one of the mineral, even it is required for the growth of the normal growth of the plant, right? If there is a deficiency of the same, that can lead to a disease called Kyra. Okay, specifically in case of rice plants. And anemia. Anemia is all caused because of iron deficiency. So when a person starts suffering from this anemia, usually due to iron deficiency in the blood, that can lead to anemia. Okay, usually the cells will become, there are different types of anemia again. If it is sickle shaped, sickle anemia, okay, so if the cells are sickle shaped, usually these cells, because of their shape, they cannot enter into the blood vessels. That leads to lack of oxygen supply to the different parts of our body. Okay, and the next disease that we have here is Goiter. It's all because of iodine deficiency. So here in this condition, that is Goiter, usually in the thyroid region of, that is in the neck region, the glands will start swelling up. The thyroid gland will start swelling up, swollen thyroid gland, just like a bag-like structure that can be absorbed in a person suffering from this Goiter disease. It's all because of deficiency in iodine. So nowadays the government, okay, that we are using the common salt, usually all of these are iodized salt. Okay, iodine content is added to this salt so that it enters in our normal regular diet. So iodine deficiency can generally minimized by this condition, right? Now we have the last one, scurvy. Scurvy disease is all caused because of the deficiency there in vitamin C. Okay, due to this disease, when a person starts suffering from this disease, scurvy, there will be disease in the gum lining, that is the jaw line, where the tooth is attached to the jaw line. The gum will usually loosen, it will start bleeding there. Okay, bleeding as well as the loose gum. Teeth will usually also, even since there is a loose gum here, it will not stick properly to that. Teeth will usually fall down. Okay, so that condition we call it as scurvy. It's all because of deficiency here in vitamin C. Now move to the next question. Which of the following are characteristics of diabetes mellitus, a common disease of human beings? Increase in sugar in blood, appearance of sugar in urine, loss of hunger, lack of energy. Which of the statements given above are correct? Option A, 1 and 2 only. Option B, 1, 2 and 3 only. Option C, 1, 2 and 4 only. Option D, 1, 2, 3 and 4. Okay, now let us look at the right answer here. The right answer is option C, 1, 2 and 4. Okay, all the statements, the first is second as well as the fourth statements are correct, but not the third statement. When a person starts suffering from this diabetes mellitus, some of the different characteristics absorbed in such people or increase in sugar in the blood, right? Sugar level, that is the glucose level, will generally increases in the blood because of the lack of insulin content in their blood. If there is no insulin, sugar is not metabolized. So that results more quantity of sugar in the blood itself. Okay, this is how doctors will usually test for this disease. So if there is more content of sugar in the blood, that can be said as diabetes mellitus. And along with that, there will be appearance of sugar in urine also. Since the sugar content in the blood, as in when we have the food, usually this glucose is then metabolized. Finally, it enters our bloodstream. It has to be stored when there is a presence of insulin. But if there is no insulin, sugar will generally be in the blood itself. So if this increases, it can appear even in the urine too. Okay, and also since there is a presence of more quantity of this glucose, lack of energy. Okay, there will be no required energy for the person who is suffering from this diabetes mellitus. They will not usually have the required energy quantity that they require to carry out all the activities in their daily life. Okay, so when we are looking at all the statements, first, second and fourth statement is correct. They are correct, but the third statement, loss of hunger, it is not correct actually. Okay, it is not at all related to diabetes mellitus. Move to the next question. Match list 1 with list 2. Under this list 1, we have disease. Under list 2, we have prophylaxis. Okay, prophylaxis. So tuberculosis, chloramphenicol, diphtheria, ETS and DPT vaccines, tetanus, BCG vaccine, typhoid, DPT vaccine. So here we have under list 2, we have one more, TAB vaccine. Okay, options are, so option A, 1, 2, 3, 4, option B, 3, 4, 2, 5, option C, 5, 3, 2, 4, and option D, 3, 4, 5, 1. Okay, now let us look at the right answer here. The right answer is option B, 3, 4, 2, 5. So when we are looking at this prophylaxis, okay, prophylaxis, which is nothing but it is one of a medical term or the public health procedure, which the main aim of this, the major purpose of this is to prevent the diseases. Okay, so before that virus or any bacteria, the germs enters our body, we have to make sure that our body prevents that. Okay, it will not pay way for this entry of these viruses. Even if it enters, that can be easily destroyed in our body. Okay, to make sure of this, usually prophylaxis is taken care of. Okay, it is one of a medical or public health procedure where its major purpose is to prevent rather than providing the treatment for the ailment. Basically, we know about the vaccines. Vaccines are usually provided to normal healthy people because even though the actual virus enters their body, it can be easily treated well by the body itself. Okay, the T cells, T lymphocytes, the T's, the antibiotics, the immune system will get activated since it has created the memory cells so that it will start fighting very well in advance. Okay, so that is the one case here, which we call it as prophylaxis. So when we're looking at the different diseases, the vaccine provided here is BCG vaccine. Okay, tuberculosis, BCG vaccine is provided to prevent a disease called tuberculosis. And we know that usually when a child takes birth, so all these are the major vaccines which is provided to them, right, at specific age group and regular interval of time. Now this diphtheria, it is treated with a vaccine called DPT. For this diphtheria, DPT vaccine is provided. It is a combat vaccine which is all for diphtheria, pertussis and tetanus. For all the three different diseases, a common single vaccine that we have here is DPT, diphtheria, pertussis and tetanus. Okay, here we have the tetanus. For this tetanus, basically this ATS as well as DPT vaccine are provided. ATS, which is nothing but anti-tetanus serum, a specific serum to fight against a tetanus one. Okay, tetanus here. So anti-tetanus serum is the one, ATS, which is provided as a vaccine. Along with that, DPT is also provided, diphtheria, pertussis and tetanus. Okay, it is a compact vaccine here. And typhoid. To prevent this typhoid here in an individual, usually TAB is one of the vaccine that is administered. Okay, TAB is a vaccine to prevent typhoid. Paratyphoid A and B vaccines are provided here. Okay, this is a paratyphoid virus. So vaccine is specifically provided to an individual to prevent all of these diseases. Clear that respective vaccines are provided in that to that individual. Moving to the next question. Match list 1 with list 2 and select the correct answer from the codes given below the list. Under list 1, we have leprosy. Here under list 2, fungi, measles, protozoa. So third option that we have here is Kala-Azar, bacteria, athlete's foot, virus. So option A, 1, 2, 3, 4. Option B, 2, 1, 3, 4. Option C, 4, 3, 1, 2. And option D, 3, 4, 2, 1. Okay, now let us look at the right answer here. The right answer is option D. Okay, 3, 4, 2, 1. Let us try to match this here. So this is the right option. 3, 4, 2, 1. Leprosy is all caused because of the virus. Sorry, bacteria here. Leprosy is caused by bacteria, and the bacteria which causes a disease called leprosy in an individual is Mycobacterium leprae. Mycobacterium leprae and Mycobacterium lepromatosis. Okay, Mycobacterium leprae and Mycobacterium lepromatosis. Both of these are microbacterial, okay, mycobacterial species which can cause a disease called leprosy in an individual. The next that we have here is measles. Measles is all caused because of virus. So basically virus are the one of the causative agent of this measles. Kala, it's all caused because of the protozoa, okay, which belongs to a genus called Leishmania. Leishmania, so it is one of a protozoa that can cause a disease called Kala Azar. Similarly, athlete's foot. Athlete's foot is one of a disease which is all caused because of a fungi. Here, the fungi which causes athlete's foot in an individual is Epidermophyton floccosum. Okay, Epidermophyton floccosum is one of a fungi species that causes athlete's foot. So, along with that, here we have one more called Trichophyton, Dermophyton, floccosum. So these are the fungal species which can cause a disease called athlete's foot. Okay, usually basically when a person starts suffering from this athlete's foot, there will be scaling or whipping of the skin there in the foot region. Okay, moving to the next question and the last question here. Cerebral palsy is a brain disorder found generally in old people, drug addicts, small children, only ladies. Okay, now we'll look at the right answer here. The right answer is option C, small children are the one who are affected by this cerebral palsy. It's one of a brain disorder. Okay, cerebral palsy is a term which is used for group of neurological diseases, okay, disorders. So the nervous system, specifically there in the brain or the spinal cord of our body, usually these are the nervous organs, basically they are affected. If an infancy, that is if the fetus or the infant, okay, after the birth, if their brain doesn't develop, okay, if the immature or if the brain does not develop, or during the stage of pregnancy, the fetal brain, if it does not develop well, if there is any damage there in the brain, so before the birth itself, or so most of the time it will be usually before the birth itself, okay, the brain will not even develop well to the normal extent that it has to be, it is supposed to develop. So that condition leads to a disease called cerebral palsy. It is one of a brain disorder related to the brain. Okay, it usually appears in infancy or early childhood, and it permanently affects body movement and muscle coordination. Usually when a child starts suffering from this cerebral palsy, usually it affects the movement of the body of that child and also muscle tone as well as the posture. Okay, a child cannot stand properly, they cannot even walk properly, just like in the normal case. Okay, so it's all because of a condition called cerebral palsy. The cerebrum is a major part of the brain, that is the one which is affected, because we know that cerebrum of the brain, that is the one which will usually control all the motor actions of our body. voluntary actions which are in our control. Walking or sitting, writing, all of these are in our control, the muscles which are here in the skeletal system. But if the cerebrum itself is affected, the motor function of our body is finally affected. Okay, that is the reason where the child cannot have this body movement, proper body movement, or the muscle coordination. Okay. So students, in this class, we have discussed about the major important questions which are related to the topic diseases. So we got to know about several diseases and their symptoms here, and I hope it's all understood to you. Thank you for attending the class.